Biggest thing and probably the hardest thing that's going to be in the beginning is trying to figure out what vein are you going to use. You have to ask some very specific questions. Has the patient ever had surgery on their arm? You're specifically looking for things like dialysis shunts and grafts because they put those in down here at the bottom. You can't use those for IV because the way they merge the artery and the vein together. You also want to ask about mastectomies, lymph node removals, things like that, because lymph nodes remove fluid. So if this IV infiltrates and they've had their lymph nodes removed, there's nothing to get rid of that fluid. If they've had a bilateral mastectomy, use their non-dominant arm and keep it elevated so that if there is fluid, it will drain. But this patient says they've never had an IV, they've never had any type of surgery. Ask them if they're right or left-handed. You know, if we want this patient to be able to do things, we probably want to put their IV in their non-dominant side. But if you have a patient that says to you, look, no one's ever gotten an IV on the left-hand side, don't be super nurse, just go on the right side. Save yourself the agony and just listen to the patient. They know what they're talking about. You've got a patient that says they're a hard stick. You've got a patient that says their veins roll. They know what they're talking about. It's not just that they don't want you to put this IV in. They're trying to give you the clues of they may not be the easiest person to have to stick. Now, IV is not a sterile procedure. Libby, will you grab me out of that gray box on the counter in the center? You're going to need some type of start kit. Most facilities stock something. If they don't, what you're going to need is a tegaderm, a tourniquet, and tape. That's what's in here, along with your skin prep. The skin prep in these we don't use on the mannequins, so just grab some alcohol wipes. But I'm going to go ahead and open my kit because I want to look at this patient's arm. You know, I want a really good picture of, can I even see anything? Because I'm not going to open up all these supplies and get everything prepped if I don't think I can stick this patient. You put the tourniquet under their arm. And you want to be able, it's kind of like restraints, you want to be able to one-handed pop it off. So you just want to tuck it underneath, you don't want to completely tie. Then I'm going to look at the patient's arm. I might start down here in the hand. That one's okay, but it's kind of crooked. I'm going to work my way up. And then you want to kind of push on the veins. You want them to be springy. You want them to bounce back when you push on them. That tells you that that vein's full and it's going to be easier to stick than something that's flat. So I think I've picked the vein that I want. So now I'm just going to make sure I have everything set up. Once you put this IV in, you become one-handed until you put the tegaderm on. So you want to make sure that everything you need is readily available, you can reach it, and you can do it one-handed. Because you can't let go of the catheter once you put it in. Once it's in there, you have to hold it until you tape it down. So I usually go ahead and kind of bend back my tegaderm. I'm going to go ahead and pull my tape. Tables are dirty, even if you clean them. The way to get around your infection control, people, is to take the first piece of tape and put it on the table. That came out of that clean kit. So it's going to protect my regular tape that's going to touch the patient from the dirty, nasty table. Okay. I've got my extension tubing. This end is where the syringe is going to go. This is going to connect to your IV. Just like the IV tubing, it's full of air. So I need to prime it. So I'm going to take my flush syringe and connect it and just flush it until I get all the air out. I loosen this up a little bit because when they manufacture them, they push them on really hard and you're only going to have one hand. So as long as the cap is on, you can lay it down. I've got my IV needle. Now these are not the safety ones, so be very careful. This is, you're going to stick the patient and then you're going to push this off, and that's what stays in. So you'll actually pull the needle completely back out. Okay, so I've got my needle ready. Last check before I put the tourniquet back on. Okay, I'll put the tourniquet on. I'm going to check one more time just to make sure I've got the right vein that I want. You have to have gloves on from cleaning the skin until you put the tegaderm on. So once the site's covered, you can take your gloves back off. Okay. One more check just in case. Once you clean the skin, you can't touch it. So just make sure you're really sure that's the vessel you're going to use. I'm going to clean inside to outside 30 seconds, or you can time lapse it. I'm going to let it dry for 30 seconds. You want to make sure, bevel up. I love when they said that. What do you mean bevel up? You stick them with the pointy part. That's what bevel up means. You're not going to stick them with the non-sharp end of your needle. It's just not going to happen. Obviously, IV you want running towards the patient's head. I'm going to hold his arm. It's going to kind of keep him from moving. I'm also going to use my thumb where that vein runs down his arm to kind of hold it so it doesn't roll back and forth. You want to go at about a 15, no more than a 30. You don't want to go in like this because, well, that's going to go right on through. So you want to enter the skin. You'll feel it release. You'll be pushing against pressure and all of a sudden it will stop. There will be no more pressure. That means you're in the vein. In real life, in a human being, this needle would fill with blood. So I'd be able to see it. So I'm going to stop advancing the needle because I want to go through the vein. And I'm just going to push the catheter part forward and pull my needle back. You have to hold this. Blood pressure will shoot it back out at you if you don't. So I'm going to hold it in place. I'm going to use my other finger way up here to compress the vessel. If you push hard enough, your patient won't bleed all over you. So I'm going to pull my needle out. Push it in and twist. That's how it locks on. Now, once it's closed, I can let this finger go. I can hold it by the tubing here so that I can see my site. I'm going to pop the tourniquet before I flush. You flush with the tourniquet in place. You blow the vein, you fail the CPE. There's no going back from that. So I'm going to flush it. Just to make sure I'm not meeting any resistance, it's flowing smoothly, it's not bubbling up. It tells me I'm in the vessel. I'm going to grab my tegaderm and I'm going to cover my insertion site. Okay. Now I can take the gloves off because I've covered it up. Pull the edges off. You can label before or after you do the rest of your taping. I'm just going to do it now. So. Date, time, initials, and the size of the needle will go on your label. After I tegaderm it, I leave a little flush in there before, and then I flush it again after I tegaderm it just to make sure when I tegadermed it, I didn't kink it. It flushes nice and easy. I'm going to go ahead and close this clamp so that I don't get blood flowing backwards. That would clot. So I can disconnect this. And then you just need to figure out where to tape it. I put it on the outside of the arm just because it's easier to get to. Some nurses will tape it like down here. You just have to remember, if we're using this for IV push meds, we have to keep accessing this. So you want to put it somewhere that's easy to get to. Clean up my mess, put my sharps in the sharps container, and that's the insertion demo.